lined up for you. I want to give you an opportunity to let people come into the room. I want to invite you to invite your friends to join the broadcast. We want to get as many people on the broadcast as possible. This isn't because I want to be super popular. It's because I want your network and you to get the information that I have to share today on the show. So today we're having another conversation about depression. We had a conversation about depression at the end of January, and I told you guys we were going to keep talking about that because I think it's an important topic that we really can't get enough discussion going about. So I'm going to invite you to invite your friends, and then I'm going to invite my friends as well. So let's all do it together. And so what we do is we click that little share button there on the Carla Palmer Show, and you just hit share, and then your friends can come into the broadcast. I'm sorry that that little feedback was there. So I've invited my friends, and I want you guys to do the same, and then we'll get started. All right, so I want to introduce myself. You guys, my name is Carla Palmer. I am also known as the GYSB lady. And so for those of you who don't know what GYSB is, GYSB stands for Get Your Sexy Back. It is a balanced approach to living your best life. We focus on your mind, your body, and your spirit. Just an overall approach to living well and reaching optimal wellness. So about 10 years ago now, I was successful with weight loss. I lost over 50 pounds, and I've been able to maintain that weight loss, give or take a couple pounds, for the past 10 years. And so my goal on any of the social media platforms that I'm on Periscope, I'm on LinkedIn, I'm on Instagram, I'm on Facebook and Twitter as GYSB Movement. So if you want to follow me, you want to get a little inspiration, if you want to contact me, those are the ways that you can find me on any of the social media platforms. Again, that's GYSB Movement. So the Carla Palmer Show is a spinoff of the GYSB movement because I wanted to continue to help inspire people to reach optimal wellness, whatever that looks like for you. So, right, it's just like the next level of living well. Wherever you are right now, it's just getting to the next level. And so on this show, I invite guests on because I don't know everything. So I invite guests on who can help me, who can help you reach our next level of optimal wellness. So today we've got a really great guest on the show. We've got Dr. Bergina Isbell with us today. How are you, Dr. Bergina?
I am very well. How are you, Carla?
I'm great. I'm so happy to have you. I want to say hello to a couple people here. Rhonda is here from South Bend, Indiana. And Dion is here from Tulsa, Oklahoma. You guys, welcome. Got a couple other people here. They haven't said anything, but I'm sure that they're going to say hello in just a little bit. So you guys, I want to invite you throughout the show. If you have any questions, go ahead and put your questions up while Dr. Bergina and I are having a discussion about depression. So I want to tell you a little bit about Dr. Bergina before we get started. I'd like to introduce our guests so you guys have a little bit of background information on them. So I'm just going to read a bio about Dr. Bergina, and then we'll go from there with some Q&A, okay? So Dr. Bergina Isbell, MD, is a board-certified Mayo Clinic-trained psychiatrist, speaker, and author. Telehealth practice where she provides mental health care and is the founder of Growing in Grace, LLC, a life coaching service. Dr. Bergina, as she is affectionately called by her patients and clients, believes in empowering people to grow beyond their current limits. She is a driving force behind positive change and building up people where they may have been torn down. She has great belief in the power of the spoken word and confidence in the word, utilizing it to help patients prosper and be in good health, even as their soul prospers. She has invested years of study in her medical profession to help others achieve their mental and life health goals. She enjoys Bible journaling, ballroom dancing, and painting. So again, Dr. Bergina, welcome to the show. Happy to have you here.
Thank you so much, Taylor. Always a pleasure when I get a chance to hang out with you.
Thank you. So you guys, I met Dr. Bergina at a women's retreat a couple of years ago with one of our coaches, Mia Redrick, who is a fantastic coach. So she and I met, we were all together at a retreat. And at that retreat, you know, it was a retreat that just brought together a lot of really powerful women, And Mia Redrick says showing up like giants. And I agree with her. You know, there were a lot of giants in the room and I made some really, really great connections there. And so a lot of the guests who have been on the show have been women who have been who I connected with at that retreat, and Dr. Bergina is also one of those women. And so I wanted to talk about depression again, because I think it's a topic, again, that we all really need to understand. I like your approach to dealing with depression, and I want you to kind of talk a little bit about the program that you have in place to deal with depression. So if you could start let us know a little bit about the program that you created and why you created it and how it can serve others.
Thank you. So the best way to describe the approach, I remember being in training when I was at Mayo, and I had a professor say to me, "You have a common sense approach to medicine." And I'm not quite sure how to take that, what that means, if that's too basic or whatever. But that is how I look at most things. I break things down to the lowest common denominator. When I talk to people, I usually talk to them about developing a system of success. And to do that, I tell people the diagnosis drives your treatment. And I don't care what we're talking about. We could be talking about depression, diabetes, MS, high blood pressure. You really have to be 100% sure about the diagnosis. And I know you all have already talked about what depression is, but I'm going to remind people what depression is not. Just because someone says, "Oh, I'm kind of feeling depressed. I don't feel so good." The word depression, it's the opposite of the word elevation. Elevation, it could be a hill or mountain. A depression could be a valley. It could be a pothole. So the difference is the way I try to talk to people about it. Every single one of us, we've been blessed with an array of emotions. We feel sad, we feel happy, we feel joy, we feel down sometimes. If you get bad news and you feel down, that doesn't mean you have clinical depression. That means you're human. Okay. And I tell people it's kind of like when you look at that old cartoon, Winnie the Pooh, and you remember those cartoon characters, Eeyore and Tigger. So Tigger was kind of on the hypomanic side. He wasn't quite manic because he didn't need to be hospitalized. That was just his personality. His behavior was just super peppy. But he was kind of hypomanic, which you watch for to make sure a person's not going to have an episode of bipolar disorder. But the opposite of that was Eeyore, who was kind of like, "Hi, Christopher."
I know. Yeah.
Eeyore. I mean, your heart goes out to him because inside of him. So he would be kind of like dysthymic. He wasn't quite depressed, but that was his personality. But that's the slippery slope. When you kind of go down, anything more down than Eeyore is probably clinical depression.
Probably, I would agree.
Probably clinical depression. And what I did is when I wrote the book, I wrote the book Victory Over Depression with and Without Medicines, and here it is. I'm only showing it because I want you to understand why that picture of me is on the front, other than the fact that Mia told me to put it up there. The reason it's up there is because
we didn't see the whole book. I want you to show it again.
Oh, I'm sorry. There you go.
Yeah. Okay. Yeah. Okay.
And part of the reason that my face is up there is because I struggled with clinical depression when I was in residency. And it gave me a very different perspective about what it is and what it is not. And it's interesting because I was in the middle of a residency and it took another doctor to say, "Hey, I think you might be depressed." And I thought, "No, I'm fine. Everything's okay." And they said, "No, I'm seeing these symptoms, this symptom, this symptom." And I thought, you're right. I never would have thought about that. And I thank God for people like Dr. Anel Prim and Dr. Harvey Watkins. And these are African-American psychiatrists who basically paved the way for people like me. And what they did is they basically helped people of color understand what depression is and what depression is not. Anel Prim was the director of minority affairs for the American Psychiatric Association. And she talked about the fact that people like us could have depression before it was okay to have depression. I mean, we're talking back in the 1980s, and she wrote a wonderful, script and produced a little DVD. And it was called Black and Blue. So basically being Black, but having the blues. And she talked about all the things that we in our culture will call depression. We'll call it having the blues or being it down. I mean, remember Mo Better Blues? Or being evil or irritable. These are
Yeah.
the terms that were okay, but it wasn't okay to be depressed, okay? Because we come from an era where, it was scary for anyone to be institutionalized or have a psychiatric illness and go to the hospital, but it was like literally terrifying, almost life-threatening for a person of color. Because if you saw a person of color go to one of these facilities, oftentimes they never came home. And so that's the historical legacy that we deal with, where people that look like me, we're not comfortable talking about feeling depressed or being depressed, because that was basically the equivalent of a death sentence for your family, because you went away someplace and they never saw you again. So when I wrote the book, I actually used Job from the Bible as an example of what symptoms were depression symptoms and which ones were not. And what we talked about, there's this a mnemonic that we use in medical school. It's called SIGE CAPS. So SIGECAPS. And that stands for sad mood. So just having a sad mood by itself is not depression. You got to have a sad mood and at least 5 of these other things. So sad mood, low interest, increased feelings of guilt or unworthiness, low energy or increased feelings of tiredness or fatigue, poor concentration. Your appetite can fluctuate. Some people overeat, some people undereat. We call it, the P is for psychomotor retardation or agitation, where people are super restless or just kind of like Eeyore, super slow. And the other S is for suicidal ideation. So if a person has a sad mood and suicidal ideation, they don't have to have the other 5. That's it. Okay. And it's interesting. I saw someone mention One Flew Over the Cuckoo's Nest. Interestingly enough, it's very interesting. The person who One Flew Over the Cuckoo's Nest, when he first went to the psychiatric facility, he did not have a mental illness. He was faking. So that's just a little factoid for you about One Flew Over the Cuckoo's Nest. But yeah, and I think the other thing, sometimes people, I'm glad Amy said that, but a lot of times in our society, and this is regardless of your race, your religion, your color, your socioeconomic status, depression doesn't know, it doesn't discriminate. It doesn't discriminate. It doesn't care what color you are or your bank account. It still can attack, and it can look like different forms. Just like I said, some people, they sleep all day, they eat all day, and they don't want to go out with people. Other folks, they're restless and agitated. They constantly want to go out and be on the move. Their appetite is low and they can't sleep at all. They both can have depression. So it can look different ways. So usually what I tell people is, take the leap and go and at least have a conversation. That's all it is. A conversation with a competent health provider.
Yeah. And so like if you have like a young person, so if you're a parent and you see these signs in your kids, can you make them go? Like, what's a comfortable way of like getting them to actually get to the doctor or get to a specialist so that they can have a conversation about how they're feeling? Because, so many kids are really struggling these days, with social media and all of the perfection that's out there and being projected in social media. And people are feeling like worthless because their life doesn't look like someone else's and they don't of that person. So how do we help our young people?
Yeah, I'm glad you mentioned that. Believe it or not, cutting out social media may help. There was a study that just came out literally within the last month or two that they actually had people stop using Facebook specifically, I think it was, for 30 days, and they actually felt better. And I think it was because of what you just said, that comparison, that, the grass is greener on the other side. People on Facebook are usually showing the better sides of themselves. They're not showing the arguments or the bad hair day usually. And so, you're seeing their best. And then that does cause a little bit of envy from other people. And that can cause a lower mood. So they did notice that people that decrease their Facebook, they increased the amount of TV they watched. But when they decreased Facebook, they actually, their mood got better. But for parents especially, or for loved ones, it's a very common question that I get. What can I do when I think a family member has depression? Well, here's what not to do. Don't tell them you need to take your pills because something's wrong with you. That's probably as bad as asking your wife or your girlfriend, are you on your cycle? Because you're acting irritable. Would you want anybody to do that to you? Probably not. I know that's the fastest way for me to go, really? Yeah. So usually what I'll tell people to do is, remember the old fire safety things, it was look, listen, and feel. Like if you think there's a fire, you look, see if you see smoke, you listen, see if you hear crackling or a down wire, a buzz from something, and then you feel the doorknob's hot, you find another place to get out, or you find a wet towel to sneak open the door. So those were the typical things that we were taught, you know, basic first aid, basic things like that. It's the same with depression or any other mental illness. I tell people to look, listen, and feel. Look, observe. The person that you're looking at, really observe, and you may have to sit back and think about whether or not the person is acting typical or atypical. Okay. Anything that's out of the usual for that person is something that you want to take note of. And I tell people all the time, keep a little memo pad or sticky pads or something. And, you know, just take little notes, put the notes in your phone, in your calendar. Look to see if there's anything that's different than the norm for that person.
Okay.
Anything that you're noticing that are major glaring differences, kind of observe. Okay. Listen to what the person is saying out of their mouth, but also listen to what the person is saying from their body, from the body perspective. Body language actually contributes at least 80% of our communication. Okay. Think about how many times you've misread a text or misunderstood a text because you didn't see the body language or the corresponding information that you can get from listening to what a person is saying, you know, how they say it, the tone, the inflection. That's very important. The other thing is, I love this phrase, behavior is speaking. Are you listening? You don't listen to what comes out of their mouth. Listen to a person's behavior. You really have to listen to their behavior because your behavior may be saying a lot of things, you know. My husband's fond of saying, you know, watch the person's representative and believe what they're telling you the first time they show you what they're telling you, because that's very likely a key to other things that are going on. And then the feel, you might just have to feel the situation out. If someone's showing you some very major warning signs, that's a do not pass, go directly to help. You know, you're seeing cuts on a person, you're seeing burn, you're seeing skin picking, you're seeing that, you know, this person that used to dress sharp and they are always on it. Makeup done, hair done tonight, hair's not done, makeup's not done, clothes, they're coming to the answer door in their pajamas, they're not answering, something's wrong. That's a crisis, that's a red flag. So when you feel the temperature, when you feel there's hot, you know, you go to that doorknob and it's hot, that's one where you need to immediately reach out for help for somebody. There are a couple things I definitely want to tell you. There are two wonderful websites that you can go to. One is Mental Health America, and the other one is NAMI, which is the National Alliance on Mental Illness. Mental Health America, which is mentalhealthamerica.net, is a great resource for finding out the nitty-gritty about a variety of different illnesses, because depression can be a part of a multitude of other things. Depression could be major depressive disorder. It could be a depressive episode in the context of a bipolar disorder. It could be depression in the context of anxiety. It could be depression because of a thyroid illness. I've even had people who have depression that's a secondary symptom related to a brain tumor pressing on the parietal lobe or the temporal lobe of the brain. So depression can be a reflection. It can be just a symptom of something else. So you want to see what the symptoms are. And Mental Health America is a great place to go to look up symptomatology. NAMI is a wonderful resource to go to for help. So if you are thinking, hey, I need to get some help to learn more about this for myself. Let's say it's not necessarily a crisis, but you're noticing some odd behaviors and you're like, you know what, I need to find out more about this, but I don't want to diagnose this person myself. NAMI is wonderful. They have two programs I absolutely love. One is called Peer-to-Peer, and the other one is called Family to Family. Peer-to-peer is for the person who says, you know what, I have depression. Something's not right. I know I need help, but I need more support than what I'm getting from my primary care doctor. I need more support than just that one visit once every 3 to 6 months from my psychiatrist. Depending on where you live, the wait list can be pretty long. I'll tell people to think about going to a peer-to-peer group, because it's a support group where they teach you how to handle having a mental illness. First, they tell you what it is, then they tell you how to handle it. And then the NAMI Family to Family is for family members to connect and support other family members so they can ask questions. So those are really good options as well. The other thing is when people tell me, you know what, I know I have depression and I've been dealing with this for a long time, or I'm new to this and I want to learn everything I can. Those are the two reasons that I actually wrote the book. That's the audience that I wrote the book for. The audience I wrote the book for were people that are like, this is my first time. and I want to get it right, and you do want to get it right the first time, because each subsequent depression increases the likelihood that you're going to have lifelong depression. So if you're a first-time person having been diagnosed with depression, I throw everything except the kitchen sink at you in terms of treatment options. We do a complete diet overhaul. We look at your nutrition. We look at your lab work. I'm making sure that there's no, incongruency in terms of your labs. If you're into alternative treatments or complementary alternative medicines, I've got 2 sections in the book just on that: herbals, essential oils, and nutrition. Okay. Because I think that can be just as powerful in certain cases as a pharmaceutical grade medication. And just be real, there are some people that just can't take certain things. I've had one person who was allergic to certain types of Tylenol because of the capsule that the Tylenol came in. So what was she supposed to do if she had to take acetaminophen?
Yeah.
So she had to go to an alternative treatment. So people can have funny allergies. And because of that, it can make depression difficult to treat, which is the second reason I wrote the book. It's for the treatment resistant person, or the person that's had recurrent depression and they don't want to go back into a depression again. That was one thing that scared me when I finally recognized, oh yeah, you're right. I have developed some of these symptoms. I wanted to make sure that it didn't recur. And so when I started feeling myself kind of slip back, I went back to, okay, what worked for me before? And I restarted it, because I had kind of slacked off with certain things. I was still exercising. I was still kind of eating healthy, but I wasn't eating the way that I was when I got better the first time. And I wasn't exercising, 3 to 4 times a week like I was, By now I'd had another child and I had slacked off with certain things. So what I did is I wrote down, okay, this is what worked for me. And so I took my personal experience with my professional experience and I put it in the book, because I said, I can't see every patient.
Yeah.
I'm only licensed in 5 states. I'm licensed in your state, California, Michigan, Minnesota, DC, and Maryland. That's it. Those are the only places that technically I can practice medicine. But I can write a book and it can reach anyone anywhere. I can have, I have a mental health coaching program that can reach anyone anywhere. And that was the reason that I did that.
So the telehealth, you can help people in those 5 states that you're in?
Yep.
Got it. Okay.
We talk pretty much just like we're talking right now.
Okay. What are some ways to approach someone that you, I guess, to let them know that you're concerned about them?
Great. I'm big on fairly upfront conversation. So after you've looked, listened, and feel, after you have looked, observed to see, make sure you've got your facts right. Okay. You've listened to their body language, you've listened to the behavior, and you kind of feel the situation out, whether it's a crisis or not a crisis. If it's a crisis, you're basically telling them, I'm concerned about your safety and we need to do something. Okay. We need to make a doctor's appointment. We need to go to the hospital. We need to call 911, whatever it is, however serious it is. It's obviously if someone's hurt themselves, that's a 911 call, or go directly to the hospital. If you felt the situation out and it's a little bit more, well, I just noticed your grades are falling, you're hanging out with the wrong crowd, you're starting to use language I would never have thought you would have used. Well, then it's a conversation. And that's when you're giving them the data that you have. And I love I feel statements. I'll tell people, start with the I feel, not I've noticed that you. No. Honey, I'm concerned about you. And I feel a great sense of responsibility for you. And I love you. And right now, I feel that things are different. I noticed that usually you're really good with your grades, or, we don't ever have to have a conversation about you sneaking out of the house in the middle of the night. And I'm starting to notice these behaviors and I'm concerned.
Yeah.
Okay. Bring it back to how you feel about it and what you've noticed, and then zip it.
Yeah.
Wait for them to tell you what they're, confirm or deny. And if the person is willing to share some information right then, wonderful. Continue the conversation. If you notice that they're just kind of shut down, if they're completely shutting down, you may have to come back another time. I think consistency and persistency are good for this. I have been accused of being a nag. And if I'm going to nag you into keeping yourself safe and healthy, okay, that's the price I got to pay. Okay, I will totally Make me the villain. I'm fine with that if that's going to help keep you alive. But, you may want to go back another day or two and just keep asking. Again, those I feel statements, gentle touches, to try to see how things are. If they're not feeling comfortable talking to you about it, especially as parents, ask your child, or if it's a partner or a spouse, ask them, look, I can see that you may not feel comfortable talking to me about this.
Yeah.
Who do you feel comfortable talking to?
That's
Who
great.
can you talk to? Okay. Who would be a good resource? I've had this conversation with my daughter just because, I'm a psychiatrist, obviously, but also because she's a teenager. Okay. And I definitely had those times where, there's just like a roadblock in the conversation and I'm thinking, okay, I don't know what's going on here. And I've said to her, look, you don't have to tell me how you feel right now or what's going on right now, but I need you to tell somebody. So who can you tell if you're struggling? And we've gone through the list of, first, I try to start with adults because I want there to, if it's a child, I want there to be a responsible adult that the person can talk to. And then I'll go down the list of friends as well. Who among your friends would you feel comfortable talking to? Okay, and I think that it's very important for parents to have an idea of who their children's friends are and at least some kind of contact information. You may not have their number, but an email, you may not, if you don't have their information, maybe the parents' information, just so that if something did happen. We live in a day and age where there's so much horrible stuff that happens to our teenagers.
Yeah.
It's just, I think it's just definitely better safe than sorry to at least have an idea. You always want to have an idea of what's going on in your child's life or the young adult's life so that you can have these conversations.
Yeah, it's so hard with teenagers too, because they give you those one-word answers when you're like, hey, my son's 19, but I still ask him, how did it go today? Fine. And it's like, okay. And then there are days when he's like chatty patty. And I'm like, okay, I hope everything is okay. You're presenting like everything is fine, or you just don't want to be bothered right now because you have other things to do. But you really never know, and then you have those instances where really, really sad. And you're like, gosh, I never thought that person would have done something like that. And I think these days parents are just scared. They're scared that they're not asking the right questions or they're not present enough. And so, as a parent, I want to encourage parents to find those moments when that your child is most talkative. And, when my son was in high school and even now, I found that after church on Sundays, if I allowed him to pick the restaurant that he wanted to go to, I could get just about anything out of him. Like, seriously, if he picked the restaurant and he got the food that he wanted, we could eat and talk and learn so much about what's happening with each other. And it was just a really beautiful way that I found that we connected best. And I just encourage parents to just kind of feel it out, figure it out, try different things. He didn't like hiking. I tried to do that with him, and I realized that wasn't his thing. That was mine. But he likes French toast. And if he can find a new French toast restaurant to go to and eat and chat and hang out with mom, he's fine with that. Even that helped me. Hopefully, other parents can figure out what works best for them. But find the time that your child is the most comfortable, happy, and talkative, and you can learn a lot in those situations. So that's my tip as a person who's not a psychiatrist, but that's my tip.
No, that is perfect. That's absolutely right. That's absolutely. All of us parents have our own. I feel like we have a minor in psychology. You have to, you have to. But absolutely, and I agree with that. And just as one little tag, whatever form of communication works best with them. Okay. There were two things I know two things that I've seen and talked to parents about that have been very useful. And I like both of them. One, the child had been hospitalized and she was kind of blindsided by his thoughts of suicide. And so she said, look, you don't talk to me and I don't know when you're okay, when you're not okay. And I don't want to bug you and I don't want to be the helicopter mom. So we have to come up with the system. And so their system was the traffic light. And so green was, especially when he came in, she was like, you got to let me know if you're green, yellow, or red. Especially if there was someone there visiting that they didn't know.
Okay.
He didn't know. He didn't want to share all of his emotions in front of this total stranger. And so if he was really good, he would just breeze by and say, hey, how did that go? Oh, it was green. It was good. Got his business. If he said yellow means it wasn't so good, but finish talking to your guests, have your guests, finish up their conversation. Or if no one's here, I don't really feel like talking right now, but maybe give me 5 minutes, 10 minutes, and then come up and see how I'm doing.
I love that. Yeah.
The red, of course, was horrible day. Maybe I got bullied at school. Maybe my teacher reamed me out. Maybe I got kicked off the basketball team. Red is, I need to talk to you right now. Your company needs to leave. They don't have to go home.
They got to get up in here.
Because I need to talk with you right now. And that was their code. So I like that. That came from a parent and a teen. The other one was The Notebook, which I thought was interesting. Not the movie, but this was basically a series of communication where they had a notebook and it was their communication system. The parent would write a little note to the child, the daughter in this case, and say, hey, how are you doing? I was just wondering how things are going. Is everything all right? Da, 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 and would leave it with the daughter. And then the daughter would go and write and say, yeah, I'm doing all right. Everything's good. This happened, that happened, da, da, da. And it just so happened that this particular child was very good with English, very bright, very literate, avid book reader, and just like writing stories and things. And that particular parent picked up on the fact that she liked writing stories. And so she said, hey, why don't we just write letters back and forth with each other?
I love it.
And that's what they did. And I like that as well, because then you got to write on your terms what you wanted to write, as much as you wanted to write. And if you didn't really feel like being bothered, you just wrote, I'm fine, bye. And then cast it over back on the bed. And, and I like that idea. I like that idea a lot for the child that likes to write in a journal, but doesn't really want anybody to see their journal. So then the parent can get a feel of, okay, well, this is what's going on. I heard there was a horrible story just last year where the parents thought everything was fine. Unfortunately, the child did commit suicide. And afterwards, they went in the room and found the journal, and the journal had all kinds of very negative things. The child was writing very negative things about herself, and her view of the world was very, very negative. And no one had any idea. So this particular idea with the journal, I like that, because that child still might not have shared everything, but may have been more likely to share a little bit if there was something like that going on. But here's the other thought that I would say for our parents, for our loved ones, for friends. We still cannot predict who is going to hurt themselves and who's not. We have a very rough idea, a very rough indicator, but guess what? We're having to revamp that. Because the old indicator was basically single, older, elderly, white male.
Yeah, it was.
Okay. Who do we see? And who did you ask me about? You asked me about young teenagers. That's not the typical, at least based on the risk factors. Okay. 10 years ago, it was unheard of to see African-American teens committing suicide the way they are now.
I know it.
So again, we don't have the predictive power that we maybe had in the 70s, 80s, maybe 90s, not in the 2000s. We do not. So I just remind people to keep their eyes open, and anything that you can think of that could be a creative way. Your child and your family members better than anyone else. Just keep the lines of communication open and find things that are going to help you connect with each other.
That's good.
Like French toast.
Yes, like French toast. Amy had a question or a comment. Technology for the good of mental health. You can see body language as well. It totally makes sense in today's means of communication. I guess when she was asking the question, you can see body language. Is it a full shot, or is it like we're right here? Like
it's like where we are right now. And so the positive is, it's very similar to Skype or Zoom, or like we're using Facebook Live or Be Live. Very similar to that. You see whatever the person's camera allows you to see.
Okay.
So there's some definite pluses of that, because I can see facial expression. I can see your emotions. I can see your body language, and I can pick up on a whole lot in this way. And this is, it's not the gold standard. The gold standard is I'm in the office, you're in my office with me, and I can see everything.
Sure.
But again, one of the clinics that I work for in California, they're in a remote area in the desert near Victorville, past Victorville.
Oh, that's way out there.
Yeah. And I think they were telling me that the next nearest hospital to them is an hour away.
Yeah.
So they can get on a tele with me much quicker than they can to get into the hospital.
Mm-hmm.
So that's a benefit. Same thing with one of the sites in Michigan that I've seen. And so technology has gotten to the place where we can do that. And there are definitely limits, like I can't smell body odor. So if the person's intoxicated or inebriated, I can't smell
haven't
it.
showered in weeks.
Yeah. If they've got a funny twitch, if it's facial or upper body, I can see that. Usually if I'm doing a test, I'll have them raise their hands or do things so I can see the posture of the body. If they've got a lower body abnormal movement going on, I cannot see that. I can't watch their gait unless I ask them to position the the camera and walk back and forth. We can do that. But if there's ever anything that I'm concerned about, or I think there's a concern, one of the things that we'll do is we make sure that we know where the nearest urgent care, the nearest hospital is. And most of the times I'm seeing patients, it's either in a clinic or they're doing it. My private clients are not necessarily that way, but we're doing it any way they feel comfortable.
Can you hear me still? Because I'm blacked out.
I can hear you now. It glitched away for a moment and then it came back.
Yeah, the interesting thing is you can hear me, but I can't see me. I don't know if the guests can see me either. There's a glitch here, but that's okay. We're going to keep going. We only have a couple more minutes.
Yeah, I can still see you if that.
Okay.
Mm-hmm.
Yeah. So, okay. Well, that's good. I know it's frozen on the other end. I'm looking here on my computer, on my phone, but that's okay. So I really want us to quickly get into your program that you offer so that I can tell people where to find you and a little bit more about your program in case they're interested in getting in contact with you.
Right. So I talk about having systems for success, and I have a 3-step signature process that I use for what I call the cure for cancer of the soul. I think there is a cure for cancer of the soul. And to me, depression and other forms of mental illness are the equivalent. They're just as deadly and they're just as important to me as finding a cure for cancer. For me, it's finding that cure for the cancer of the soul. And the steps that I do, the basic steps, is I take you through 3 steps. Number 1, I check your vision. I give you a visual acuity check. Okay. And what we do is we look to see how close your life is right now, how much that matches up to your vision and your purpose in life. Okay. If that's off, honestly, that can lead people down that slope towards depression, even if they have no family history or no physical issues at all. Because there is significant data that's shown that when people have purpose in life, they're much likely to be happier, they're much likely to feel fulfilled, and the risk of depression is very low. So that's where we start, because I think that's the root of the problem. Then what we do is we find out whether or not you're having an identity crisis. So we check your identity. We look to see if that vision matches up with what your identity is and make sure that they're in proper alignment. Because if they're not in alignment, if there's disalignment there, it's just like, needing to go to a chiropractor because you've got scoliosis and your body, and instead of your spine being straight, it's curvy and all over the place. It doesn't feel good, and you're not going to be able to function as well. So we talk about making sure that your identity is where it needs to be, that you understand what your ideal identity is, and that you're walking in alignment with that, including your goals. We want to make sure vision and goals align together. And then the third thing we do is I help people to go from being full of fear to living fearfully. Okay. And living fully. Because unfortunately, a lot of times we think that depression and anxiety are completely different. We now know we believe that they're on a continuum, which is why antidepressants work for both depression and anxiety. It's just we usually have to get higher doses for anxiety. But once we talk about that, once we talk about some of those fear factors in your life, we're able to move past those.
And where can they find you if they want to learn more about your program?
Okay, so one of the easiest ways is to go to bit.ly/Dr. Bergina Home, and you'll get a whole bunch of information there. If you scroll all the way down, you'll see the book from 2017, The Victory Over Depression, at the bottom. You can order that online, and this is a fairly economic way to be able to go through the entire portion.
Okay.
7 chapters, I think. And at the very end, I talk about the science of what we go over in the rest of the book.
Okay.
The bit.ly also will take you through some of the other areas where you can reach out and find out more information. We both do Periscope, and there's also some information about other ways to connect with me. The other thing is I have people will often go to my website, which is www.drbergina.com. And when you go there, you can find out ways to work with me individually. So there are folks that will sign up and they'll come and they'll work with me individually. Sometimes people will just need a consultation. One of the things that I offer that came out of the book is the Victory Over Depression online course. And what I do is people will take anywhere from 12 weeks, which is 3 months, all the way to a year to complete it, depending on their severity level. But what we do is when I'm having people enroll in the course, they go step by step through that process that I just took you through. And I love that. The first part is very introductory, and it's going through the book. The book chapters is read for you. I read it for you. And then we go through a series of exercise. We've talked about some things, and you're actually in part of the course, or you will be in part of the course. I'm going to be adding that in because I wanted people to have a variety of options for exercise. Charlotte Boot talks about doing workouts with basically whatever happens to be in your home. I'm Strong by Zumba certified, so I do a session in there. I have Leslie Sansoni, Walking with Leslie Sansoni is in there. Paul Eugene does some chair aerobics in there. Praise Moves, which is a Christian alternative yoga. There's a sampling of that in there. And of course, the jump roping. So if anyone's interested in using jump rope as an exercise, there's basically links out to the programs that people have on a variety of platforms like YouTube and Vimeo.
Oh, that's amazing. I love that. And before we go, can we really quickly, because we're over time, but endorphins, I mean, like the hormones, those are real, right? I mean, that's what I feel when I work out, but they're real, right?
They are very real. They're very real. And I tell people that they can get a dose of medicine every day. DOSE. Dose stands for dopamine, oxytocin, serotonin, and endorphins. So those are the hormones, those are the neurochemicals that your brain and your body naturally make when you do a variety of natural exercises. So for example, when you exercise, E for exercise, you release endorphins, and those do elevate your mood. The DOSE, those are the hormones that we call the happy hormones. Dopamine, once you set a task and then you accomplish it, accomplish a goal, that increases dopamine and helps you feel better. Oxytocin is the same hormone that when a mom bonds with baby, that increases. But it's not just for moms and babies. It's for any relationship, pets, plants included. S is for serotonin. That's one of the hormones that goes up when we take chemicals for depression. And all antidepressants that are in the SSRI category increase serotonin, but so does sunlight. So does being outside in the fresh air. So does some forms of exercise as well. And when you review a goal that you've accomplished, that can increase serotonin as well. And then, of course, we've already talked about the E for exercise and endorphins.
Yeah. Awesome. I'm glad that was a true thing. I mean, you read about it, but then you have people who say, oh, I work out, but I don't feel anything afterwards. And I'm like, what? How do you not feel anything? And they're like, I don't get happy about it. I'm just like, okay, I did that, and I wish I wouldn't have even gone. And I'm like, okay, I don't know what that is. I mean, hey, if that's their truth, that's fine. But I didn't really understand it. So I was like, maybe I'm like one of the few people who really feel that. But if I go and work out, even when I don't feel so hot, once I get in there and I get my workout in, and then afterwards, I'm like, I feel so good. And I also feel like it trickles into other areas of my life because I'm like, wow, I had some control over my feelings because I went and I did something to take care of it. And I feel so much better now, and so when you feel that sense of control and those endorphins are like, they're released, you're like, wow, this is amazing. So, hopefully a lot of people don't feel like that, but that's what she said. Yeah. I was like,
well, for that when people tell me that they feel worse once they've worked out, it's usually one of two things. One, if a person is already ill or sick, or just their body's already not in a good place for working out, they've had an injury. That is absolutely true. I've had people who are working out and they're pushing themselves beyond, or they're at the risk of re-injuring themselves. You will absolutely feel worse afterwards. The other is if they're not doing an exercise that they really enjoy or love, there's an exercise for everybody. That's what I truly believe. I really believe that. And that's one of the reasons in the course, that 1 week that we go over exercises, I purposely try to introduce more than one because I like HIIT exercises. I like high intensity interval. But not everybody likes that. And so if I said, okay, you're going to do strong this week, by the end of the week, you might hate me because I love burpees. But if you're not a burpee person, you're going to be like, really? When I find her, it's something new. But not everybody is a yoga or praise moves or stretching kind, Pilates kind of person. Some people hate that. Okay, fine. Yeah. Maybe you're boxing or kickboxing, but whatever it is, I usually tell people it's probably because you haven't found the exercise at your level that you enjoy and that you like, because it really does need to kind of be something that you like.
Yeah, I agree. Well, if you don't have anything else to add, I mean, this has been such a great, informative session. I appreciate you being here. I'm going to go ahead and close out. I don't think there are any other questions. People did like the I feel statements, I can tell you that. And the ideas of how to connect better with our children. I think that's important too. So hopefully people got some good information out of this. I certainly did. I appreciate your time, and maybe we'll have you back again next season if you'll join us again.
Absolutely.
Do you have anything else that I may not have asked you that you have to add, or?
No, I was just going to say thank you so much for having me on. It's always a pleasure, like I said, when I get to see you and when I get to work with you. And I will tell you that the work that you're doing with Get Your Sexy Back, I think it's phenomenal. I think it's unique. It is. And it's one of those things that we started doing when we were younger. And I think people get away from it. And I love it because it allows you to get back to that inner child, which I think it's wonderful. It really is.
Thank you so much. Thank you so much. Thanks for the support too. I appreciate it.
You're welcome.
Standard time, and we'll see you. I hope you'll join us, and please share out the video. It'll be up for replay, so share out the replay and invite your friends to the show next Sunday. And if that's it, we'll see you guys next week. Okay, take care. Bye-bye.